Dr. Fisher, you're the first to say there's a need for the medical community doctors as well as for the chiropractic care, and there are differences between that.
Yes, there is, and it is important to work together, especially for the betterment of the patient. I mean, that's what we're here for, is to take care of the patient. But there are differences. I mean, the medical profession is, generally speaking, blood-based. We're really nerve-based. We know where the nerve supplies every organ, every function of our body. Matter of fact, it was back in 1972 when the American Medical Association came out and said, "Hey world, guess what?" And everybody says, "What?" And we said, "It's not when your heart stops that you're dead, it's when your brain stops that you're dead." And so they learned at that time, if they hadn't learned before, that the nervous system is the controlling system of the body.
And I think the thing that I know I've taken most is that you treat the cause, not the symptoms, which is number 2 on that list.
Exactly. And they do. I mean, they're great at treating symptoms.
Yes,
I mean, they've got some great things that will help take care of symptoms. We don't prescribe drugs. They do. We make adjustments. We slowly but surely move that back in alignment. We'd love to tell everybody they come in for one adjustment and psh, it's all back in shape, but it didn't happen usually all at one time, and it takes a while to get those back into place as well.
Exactly. I like the idea of seeing the person as a whole person instead of just what is ailing you and take that part.
Exactly. And we do. We look at the whole person. We look at you as a well person as well. Dr. Fabio Mancini, who is the president of the Parker Chiropractic College in Texas, was on the Dr. Phil show just the other day, and he's got a new book out, but his whole point was trying to tell people that we look at the whole person, not just as little parts, not the shoulder pain, not the ear infection, whatever. We're looking at the body as a whole.
Well, since there is a need for both professions, why do I want to choose to come to Dr. Fisher, to come to you? You have quite a bit of experience, and you've been here in the Valley for some time. In fact, tell me a little bit about your background.
Well, my background is I call myself homegrown. My father was a chiropractor. I had him to follow in his footsteps as well. But I have been practicing for over 30 years. In California, I had one of the larger practices in Southern California, and I've given over 250,000 adjustments in my career.
You're very well trained, very well, yeah, you know what you're doing, and you have a great personality, and you feel really, really comfortable here, which I also think is important to have that relationship with your doctor.
Well, I think so too. And I've adjusted babies that were only an hour old, and I've adjusted 98-year-olds that could barely walk into the office.
Well, and that's an interesting point we should make, because I always think of it being an older person's need when really children as well.
It is. I mean, they say that the average child falls over 2,500 different times, and that 50% of the time it's at a height taller than they are. Not that I would recommend anybody go try it, but just think about yourself getting on a fence that's 5 foot high and falling 1,200 times. Right. How many times would you get up? Well,
you know, your grandchildren were in here, 2 of your grandchildren, and they're just as cute as can be, and you said that you have worked on and adjust them as well.
I have. One of the exciting things is being able to help children that have had ear infections and help them so that they didn't have to have tubes put in their ears. And
see, I love that, because when you think about an ear infection, what do? You call a doctor, because we want to treat that symptom where you can treat this cause. I'm so glad you brought that up.
Yeah, and the thing is they can go there, get the medication to get rid of the pain and help fight the infection, but if we actually give an adjustment and help restore the nerve supply to that ear as well, maybe they don't have to go past that.
Well, and we've talked briefly about my migraines. I go in, I get my Imitrex shot, and I give myself a shot, I close my arms, and I lay down in bed, and I think I'm going to die because everything constricts, you know. I wake up, I'm feeling better. So get rid of the cause.
You get rid of the cause. I mean, there's nothing wrong with getting rid of the symptom too, other than any time you do something to yourself that affects the rest of the body, it is a negative on that body. I mean, even taking an aspirin, I mean, that's why they went to Tylenol and all the other different things, is because it causes your stomach to bleed. That's not healthy for you, okay, right? But there is a good result with getting rid of pain with some of those things too.
Well, now people might have a lot of different questions for you. I understand you have this dinner with the doctor on a monthly basis. Tell me about that.
Yes, we do, and we encourage you to give us a call at 752-5522 to come in and see if we can have you invite you to our dinner with the doc. We do it at the Bluebird restaurant now, and it's totally free to you. Dinner's on me. The thing is, we talk about health, and we talk about some of the differences between chiropractic and the medical thing, and looking at for your optimal health for you.
Exactly, because that's your goal, is to give everybody their optimum health, like this lady behind us on this poster. I mean, make me feel that good, please.
Exactly. We want that, and we want to feel good, and life is good when we feel good too.
Exactly.
You know, and getting rid of symptoms is nice, but if we don't go past that and go for the corrective part of that, those symptoms can keep coming back to you.
Absolutely. Absolutely. Okay, now you also do a bi-weekly meeting right here in your office?
We do, and we talk about the 5 keys to health at that meeting. And so again, you can call the office at 752-5522 and have that opportunity to come to one of those classes. They're all free.
I was just going to say, free of charge. You can't beat that to enjoy that personal time with you.
Yeah, well, one of my biggest things when I got back into practice here in Utah, I practiced 26 years in Southern California, but when I came back up here to practice, my intent was to try to help as many people as I could and try to make it as informative as well as inexpensive for people as possible. And so that's why we do a lot of these things at no charge.
Well, here in the Valley, we're always looking for a good deal, but a good, safe deal and somebody that knows what they're doing, and that's what you get with Dr. Fisher. In fact, right over here, you've got the happy spine.
Yeah, I got my happy spine here. I think it's kind of a fun thing, but these little holes in here, that's where those nerves come out of there. And if these bones move out of place, it can put pressure on some of those nerves, and that's what I'm here to try to do, take care of that.
If you need a huge demonstration, it's right here. Dr. Fisher, thank you so much for your time and this information. We all want that optimal living.
Thank you. It's good to be here.
Thank you.